Burleigh County Human Service Zone Board meeting. And we do have a couple people via phone. I don't know, Tan, if you're on by phone, if you want to do roll call.
Yep, I can do that.
Thank you.
We'll start with Galen Becker,
Here.
Senator Dever, Tracy Famous, Jim Holm,
Here.
Leslie Piercy, Trevor Vanette,
Here.
Commissioner Matthews,
Here.
and Director Flory.
Here. So we got a small group today, so hopefully we can cruise through. The first thing on the agenda is the approval from the meeting minutes from the February 21st, 2023 meeting. So if anybody had a chance to look over those, if anybody wants to motion to approve those.
I read those when they first came out and everything looked in order, so I move approval.
Second.
Thank you, Trevor. So we have a motion and a second. All in favor?
Aye.
Aye.
Thank you. Any opposed? Well, that's everybody, so, motion passed. So then, really all the agenda is just kind of giving some updates on the units. I will try my best to get through some of my notes, that I gathered about, we'll start with economic assistance. I did provide those who are present, so Trevor, I didn't get you this, but I can get it to you, Trevor. We had received a handout from the department just kind of going over the goals of redesign. So you guys just have a better understanding of what that means when we talk about going live, redesigning economic assistance. So we have been live working as regions since February 13th, 2023. This is serving, so again, to recap, Dakota Central, Burleigh County, Three Rivers Human Service Zone, Rough Rider Human Service Zone, and Southwest Dakota Human Service Zone. So it's all of our zones working together to work in more program-based for economic assistance. So this just kind of goes over where that idea came from, what the goals were supposed to be, eliminating backlog. So there's just been some strategic planning it'll go over as directors that we've agreed upon to unbury certain areas of the state and certain programming for backlog they may have. So for an example, there could be an area of the state that had TANF applications from October that just hadn't gotten processed, whether that was for capacity of work or the work that was coming in and their lack of staffing. So we've really just been all hands on deck trying to get those processed so people can get their benefits. So we've had great success with that. We went into the redesign without any of the backlog, but we helped our own region unbury from their backlog, and we continue to do that. And then we are helping other regions as well. So even though we're region over here, we're still helping Cass County or Rolette County, whoever needs that. Your question? Yeah.
Yeah, I'm just gonna be like the naysayer here. So what is the plan so these regions don't end up in backlogs again? Is it to get caught up and stay there? Because how is it that the other regions had these backlogs or zones and our zone did not?
Correct, yeah.
So how was that, and how are we gonna prevent that from happening again? And there are eligibility workers that came out of the Burleigh Human Service Zone. Are they pulling a bigger weight because they're just used to doing that?
Right.
And making, I just have concern.
Yeah, no.
About work equity with our employees that are in doing this work.
So, two parts then. So the reason that some places could have had backlog, like I said, could have just been the amount. So some of your more impoverished areas are going to have more people looking for those services, and then they have less workers or they had turnover. You also had, where in some of the rural areas, you had one worker who's serving all different programs, where in Burleigh County, we were a little bit more specialized. So even pre-redesign, we had a group that was doing just Medicaid or just TANF or just SNAP. So they were able to, like, under theory constraints, work quicker, work better, more efficient. So as we've now moved to that model statewide through this regional, that we were kind of already doing that in Burleigh County. So that might be why we went into it with less backlog, is because we were already operating that way. So that will help as they get more streamlined, that theory of constraints being applied to it. We're doing a lot of comp time for our staff if they're open to it and want to, and it's not just us, it's statewide trying to unbury the backlog. And then as they're also looking at the staffing model. So when we went into redesign, we had the people we had, and now we're just looking at, do we need more positions? But we had to get into it to assess it. It's one of those things you gotta get into to know what you need. So as far as your other point of your question of what are we doing to, yeah, we're monitoring timeliness and all that. There's different, I had a great definition of it earlier. There's just different things they're doing to really work through performance, like monitoring all that. A couple other things then to that point that I had noted is just for me, and I think for you guys to know as board members, I'm just going to speak on behalf in this part, just Burleigh County. I'm doing a lot to make sure that the zone staff are being heard as the frontline workers. Their input is not always applied or even acknowledged sometimes, so I'm really doing my best to advocate. Like, these people know, they're the ones working the cases, they're the ones who are telling you, we're getting this error. So much of it is like system error. So they're getting on calls saying, correct, you're telling me it should work like that, but I'm getting this error, it's not working. So we're working on a lot of programmatic bugs through the system that's used. They're teaching me a lot about words that they use that I don't understand, but we're getting there. This does cause frustration and burnout. 100%. The team just, they don't feel heard. So I'm just doing the best I can to make sure that I'm pushing all their feedback, questions, and concerns along to the, really the HHS and their administrators over that program. And I'm not that they're not responsive, it's just they're also just trying to mull through it. So just continue to charge ahead on that. Open positions for that one, we have EW or eligibility worker tech position that's open, an eligibility worker 1 position that's open. So these are just the workers doing the work. And then we also have a call center position open. I could probably have a whole meeting just about the call center. So I don't have, I think, my notes to tell you like the current staffing, but they're averaging about 7,000 calls per week in the call center. The average call time on those, this is a report that I received from the department then. Average call time on that is 10 minutes per call. Some weeks they're having a better success rate, but sometimes they average a 50% success rate for those calls being answered. Whether that's because somebody just calls and drops off because they didn't want to wait in the queue, or I guess, or they get kicked out of the queue. I don't know, but it's not the best. So the department is very well aware of the call center and the impact that's having to clients, and so they did just say that we're working on getting 25, I think it's 25 now, I gotta find my note, 25 temp employees that are gonna be hired through this contracted services brought in from this provider to work more of a tiered system. So they're gonna take the tier 1 calls, they're kind of like your basic calls. Then if they need to be moved on to somebody who is more like your current call center who can dive into the work and get you the policy procedure answer, they're gonna be moved to the tier 2. So it's really just trying to get the calls answered. I'm trying to look at, this is the same, they've worked well. I'm thinking this is coming from ND Rent. I feel like that's who had a call center experience. So they've just really been working with how call centers are operated and just learning curves that we're learning. They've identified some performance and training issues through the call center. Now that we're doing the statewide model, it's a lot easier to see who's taking the calls, how long people are actually working in the programs, like all that stuff is better monitored so we can address some of that performance. I haven't gotten any concerns as far as, I guess as my board members, if you're curious if it's our employees, we haven't had to address any performance issues. And again, I think Burleigh County has just been used to operating at that capacity, so I'm not too concerned, but obviously we'll address it if that happens. Any questions, I guess, on the call center? It's not a great. Okay. Other things to talk about, open positions within our region. There are also 4 open positions from another zone within our region. So total within the region that we're operating, we have our 3 open positions, and then there's 4 additional. So again, still battling the short-staffed work.
Is the other areas in our region work from home also, or do the other 4 positions need to go to, like ours are work
From home, yeah.
home? Are those other ones, or does it depend on the home county?
Depends on the home county. For the most part, they are not work from home. I'm finding through this redesign that Burleigh County is huge on them working from home, and I will advocate that that keeps the work moving. Eligibility is something that when we've had these snow days, we've been able to keep business as usual and keep it moving. Where we've seen if people are going to close, it's really impacted the call center. You can go down from 23 call center staff to 13 in one day because people aren't able to work.
Well, I think the numbers just going in with the backlog in other areas in our zone did not in February, and then looking at that our decision to let eligibility work from home did not hurt our productivity and getting in the backlog. And,
Correct, yeah.
And really some of this work that's happening, they were already boots on the ground ready to go.
Yep.
Where other ones are not there yet, other zones, because they didn't have that work model. So,
Yeah.
I feel like we made a good decision
Yeah.
without a crystal ball back then about our eligibility workers.
No, 100%. That's probably a variable to why that could be one for why we didn't have the backlog as well. So that's continued, and I know Trevor and I have had many conversations about the work from home. I mean, he's echoing the same things to me when I run into him up at session, that the work from home, our people then have to continue business as usual, but then other people are getting that closure. So then it's just more work put on to those who work from home is kind of like, one of the concerns of that and the caseload capacity. The other thing that Trevor and I talk a lot about is some of these other host counties allow people to have Fridays off, or half days on Fridays, and that's a county commission decision for that whole county. And so then if that's the case, then those groups are automatically cut short, and then it leaves our workers thinking, can we take Fridays off? We talked about this at the last meeting. There's no new. So I told Trevor he could talk to his commissioners about that. So, but those are just things we still continue to. I am promoting that if my team needs time off and they want a Friday off, though, I'm not going to not allow them to take that time off because of that variable. So they're still doing that. Okay. The other probably big thing for economic assistance is our indigent burial. We talked about that last time, and I know after the meeting, a couple people mentioned they didn't even realize we did that here in Burleigh County. So, when we are approached that there needs support with burial funds or cremation for somebody who would be homeless or doesn't have any of the means, we do have a worksheet that's done to determine how much then the zone covers that. So this was previously done differently depending on the county or the zone. So we could have set our rate that we're going to provide for that, and it could be different for Dakota Central, South Country. So this bill is up for session, so this is 2139, and this was to adopt a standardized for the state. There's a lot of work from the directors as well as the funeral home directors for the state of North Dakota. They have an association as well. What did they feel like was a fair rate? There's lots of conversation on burial versus cremation, what we have to cover. So the final bill, I think it, from what I read, the last action did pass through. So it's, I think we've all ironed it all out. So it looks like the rate that we agreed was that $3,500 per burial or cremation. So I don't know a whole lot if anybody has questions on that, but I would just urge you to read 2139 if you did, to just get familiar with what that looks like. There's a worksheet. I could get you the worksheet so you could see a template, but when somebody needs that service, there's just it's like a rubric that we go through to decide if they qualify or not. And there's other things we have to consider, like if they have assets, and then who's gonna, what that looks like and impacts what we pay, so. Tayon, being you're on, I don't know if you have anything you want to add on indigent burial. You're more familiar with that program than I am, like historically.
I guess I don't have anything specific. I guess the whole process for the indigent burial eligibility determination, I think, is expected still to stay pretty much the same. Like Chelsea said, it's really just a standardized rate that's coming into place. Previously, our max burial rate for Burleigh County was $2,100, so that would be increasing then to the $3,500 per event.
Historically, how many are we having of those a year? Do you remember at all?
It varies so widely.
Okay,
Year to
okay.
year. We could have 12 one year and 24 the next.
Okay.
So yeah, it varies pretty much, but I mean, there's some years where we spend 20,000, some where we spend 45,000. Again, I think your eligibility determination process is still going to stay the same. So quantity wise, it'll likely be pretty similar. I think we did see a little bit of a decrease in the last year or so when we went to the state's new formula or process for eligibility determination. And again, we were at 2,100 per burial event. So I don't, it's not going to be a tremendous increase for us. And again, this is a direct expense. So it's something that the DHS formula payment provides for in their budget. We work with the state on that.
And we provided them as directors statewide the number of burials we've seen, and so they could come up with a number to propose during session as they were doing this work with the Funeral Home Association directors. Yeah.
Thank you.
All right. So then we'll kind of just move into the.
Can I bring up one other
Yep.
bump with eligibility? When does the emergency,
PHE,
end? Isn't that May?
May 10th.
What is expected to happen for eligibility workers at that point in case loads?
Well, it will impact it for sure. As they've operated underneath that public health emergency, it changed the work that they put into reviewing those applications. And so now they'll have to go back and treat it like business as usual. So it will be more. Some people have never done processing of an application without the public health emergency in place and those adjusted guidelines. So I think they've done some training. I think they've worked through their state program to work on some of that. So yeah, I mean, we know that that's going to be a change for people, but that's a pretty good group that they have there who's running that. So, and I trust their leaders. And that's not me, but they're other leaders. Okay, I'll move into the child welfare portion. So I'll just kind of go through unit by unit. So our child protection unit, and I'm just going to be transparent. I didn't do a great job probably reviewing some of these the case log. I'll just tell you, we have been busy, very busy. So I was able to work with our child welfare program manager who oversees, helps me oversee the whole child welfare unit. And we provided the department with some data on the caseloads that we've been seeing in the child protection unit, the comp time that people have been accruing, just trying to complete the face-to-faces for policy and law on that. And we were able to work with them and get approved for a 10th CPS worker. So that would be a win for the zone and the board to know. So that one I think closes today. So if anybody's watching this and would like to apply, I think it closes today. So we will interview for them in the next few weeks for that 10th worker. So technically that team is fully staffed as it stands, but that's an addition. And then we also went through the same data and policy and were able to advocate to the department and get approved for a second CPS supervisor for that team. So you're going to see that team grow by 2 then. The current CPS supervisor has a 9-to-1 ratio. So if at any given time, somebody has 20 cases, she's responsible for staffing and providing guidance on all those. So it just wasn't a good ratio. And nor was it supported by policy. So that's a win as well. So that position has been posted, closed, and I believe we interview this week or next week for that second supervisor. So yeah, I don't have the exact caseload that came and went. You would have got the report from Taeyeon earlier in the month. But I will just tell you, it's been busy. The in-home unit is fully staffed. I don't have much to report as far as caseloads for that unit, but they have 1 supervisor and then they have 5 in-home workers. And they've all now been onboarded, completed. I think they're in their final week of child welfare training, so that's great. They're ready to go. I mean, they've already had a caseload for a while, but I will just give kudos to that team when I've done meetings with the department and we're talking about in-home services across the state. They're definitely stand up Burleigh County for using in-home for its purpose. So a lot of times what we're trying to do, the goal is to be least invasive on families, prevent kids into foster care. So it's trying to work a CPS assessment, capture those who are identified as needing services, get those services in place and in-home and keep them in the home. And so they're definitely standing up that Burleigh County is using in-home the way it's created to be done. So I just think that that's kudos to that team and those workers, so. And the CPS workers for identifying those needs and getting it to the right place, so. We also have parent aid positions, so we technically to be full staffed, there's 3 parent aides, so these help with like, we can get them on cases to work with some skill building on families, do some appointments, getting people to different things they need, transports and visits. So full staffed is 3. We currently have, we just onboarded our second one a couple weeks ago, and we are just interviewing this week for the 3rd. So again, vacancy there, but working on that. And we also have 1 position for somebody who's strictly designated for transports and visits and help facilitate that. And that has been open for, I want to say like 8 months. And so we've just hired, offered that position, and I think they start in May. So still technically vacant. So hopefully when I see you next time, we're fully staffed with those. And then in the case management department, we have had a few changes at the board. I probably haven't updated yet. So we have 9 case managers in that unit and 1 supervisor. I was able to again work with Tayon. I should have said Tayon too earlier. Tayon and our child welfare manager to pull data and information, and we got approved for a second supervisor in that unit as well. So that unit will grow with another supervisor. Same thing, that 9-to-1 ratio. We average like 170 kids in care, so that's a lot of kids for 1 supervisor to try to manage and support their team with. But the day that we got approved for that second supervisor, the current supervisor did resign. So we've had no supervisor in that role for maybe like a week, 2 weeks now. So when I look frazzled, we are just manning the team. So looking at that position is closed, and we'll interview for that this week into next week. So from that pool of applicants, the goal would be to hire then for both those positions, and we have 2 open. We've also had turnover in the case managers as well, so we currently have 1 opening in the case management, so. With that, I probably went into crisis mode with the case management piece and reached out to our fellow zones, the surrounding zones, so Dakota Central, South Country, 3 Rivers. And I included the department, and we had some conversations around caseload capacity. So right now, I only consider 7 out of 9 staff. We just onboarded 1 maybe a month ago, so she doesn't have a caseload. So technically I have 7 out of my 9 FTEs and full-time employees doing cases. So we average anywhere from 18 to 30 cases, children per worker. In state policy, there's no standard for caseloads like there is in CPS. That's something that they want to talk about doing through a redesign, but it's not as easy as just counting each kid per caseload. Like each kid comes with certain complex needs. There's variables. It's really hard to determine what that is. So anyway, so we had reached out to these surrounding zones and just had frank conversations. You know, 3 Rivers, they could average 6 kids per worker caseload, and I'm averaging, 23 if you do an average. So we go anywhere from 18 to 30 some, but 23 if you just leveled them all. So we've had a lot of frank conversations with them about how they could help us. We share the same community. So they are doing some creative work with us and helping with transports and visits, which would pull my workers off of those kind of duties so they can do their court affidavits, do their documentation for their team meetings, working on some of those more time-sensitive things while somebody else can help with some of the appointments. So we did get a good response from those other zones being willing to help us with that. If anybody, I guess, has any questions about how... That's kind of it for their caseloads. I guess I'm kind of blanking on if I had anything else. I'm just going to go over last meeting notes. Just continuing to work with our stakeholders to staff, do any case consults that anybody's interested in doing. I've, especially with the schools, we've done a lot of case consulting for kids, our families that are kind of at risk, that they just want to know how to do more preventative work. They have more social workers in the schools than we do like on our child protection team. So it's really about like helping with more preventative to prevent it from getting to our level. So we've been able to do a lot of that, doing some trainings with them. We were able to get our team to an ethics training that we put on, which a lot of them needed that anyways for CUs, but just in general, just to brush up on ethics as they're working. I don't really have anything else for the child welfare team. I'm sure I'm missing. I'm sure somebody's watching this thinking I'm blanking on a bunch of stuff, but. Okay, so then the next order of business is the financial report. I don't have anything to add on that, Tan, if you have anything you want to add specific for that part.
I guess I don't have any specific comments on it. It's the March report you guys would have got most recently. If you have any questions, you can let me know. I guess here in April, May, we will start working with the state on coordinating process for the upcoming budget, setting that for next year and stuff. So that's still to come. We haven't quite started that process yet, but it will be starting shortly. And then, of course, after that comes the county commission budget process too. So we'll be a little bit in advance of that. But I guess if there's any questions, let me know.
For Commissioner Matthews, we do have on my calendar that there is a financial meeting we're doing next week.
There's a financial workshop for commissioners from 3 to 5 on Monday next week. Just going over properties we own, plans financially for 2 years to 5 years, looking at our investments, looking at, we did have a challenges and opportunities document made up about 2 years ago, kind of look at that and looking at changing that into a strategic plan. We have new commissioners on, we have new staff on, and looking at where we're kind of going with the Provident building, pulling back, if we're going to stay pulled back or what we're going to do. So it's more just there will be no decisions made there. It will just be more of a think tank and looking at what direction we're going to be going with properties, buildings, finances, staffing, things like that.
So Tan and I both intend to attend that meeting. On the agenda, it had said specifically about social services in our current location and our lease. So I just wanted to make sure we were there to answer any questions about what we're looking for. And then in addition, for the board here, that is what they should be aware of is, just really advocating for the space that we have and being housed in an area that's good for our clients. So,
well, and that is something that there has been some educating on my part for my fellow commissioners and for other county staff. This hybrid zone is interesting, so that they're like, well, can we get a long-term lease from the state, or why doesn't the state have a place to house them? Because we live where the capital is. That's, I said, because it's the county's responsibility to provide that space and building, and that is our responsibility to do. Now, some of it is built in the direct cost to cover some of that rent. Correct me if I'm wrong here, Tan, because sometimes I do.
You're correct. Yep,
Thank
you're
you.
correct in that.
Thank you. I thought I was. I've kind of, but so I've been very clear. So if that comes up again, to reiterate that and say, in Century Code, we are the ones responsible for that and needing the space for our staff, for visitations and for our families and children. It is very, very important. So.
no, I appreciate that. Okay, the next thing on the agenda is public comment. If anybody wants to make public comment.
Hi, Zone Board. My name is Mike Conley. I went to a 1 Million Cups event about 2 months ago, and now I'm on the board of directors for Haven Hills. It's a private effort to impact the foster care needs in the county, and so we'll probably be working with a lot of you going into the future, as we're always chasing needs that seem to be far ahead of the resources available. And we're having an event on July 12th that will keep you informed because we're just in the planning stages of it. Right now, we do have Braveheart. It'll be at the location that they plan on building. It'll be, if it's full build out, 12 homes that could service up to 40 foster kids. It's a big lift, but we have a good team that's really pushing hard to where a private foster care community could really complement what the zone tries to accomplish as well. In meeting the needs of kids that desperately deserve help. So far, I've talked to Sheriff Lieben, and he said he'll have an officer for a dunk tank, and we're recruiting others. If you know anybody that wants to volunteer,
Jim.
I've been volunteered too with the new changes in the last week with my status, but just wanted to make the zone board aware of it and this public comment, and as we try to help each other meet the needs of people in our area. Thank you.
I got questions too. If Becky, if you want to go, I just want to talk more about the program. Yeah. Should say for the record that they also asked me to be in the dunk tank. So if I say it and it's on the record, then I probably have to do it. So I did say I would do it. So good cause. If anybody wants to dunk the director, you can come and do that.
What time are you gonna be up?
I'll
This
let
can
you
be
know.
a new hire recruitment tool.
Staff,
Good idea.
staff retention. Okay, no, but really, she did ask, and I said absolutely, I would do whatever I could do. So I think she said this was in July. Do you have
July
a
12th.
July 12th? Okay.
It'll be, I believe tentatively the gates will open at 5, and then the band's playing from 6 to 9, and food vendors, and then we're still kind of coming up with ideas on how it'll all unfold, but wanted to get in front of it as much as possible. Dates and times are important because summers fill in quite rapidly. Mm-hmm. So
And Mike, where's it going to be at again?
if I could remember,
Yeah.
The best I can give you is it's 11 miles north of Bismarck. So I can send you that information, Galen. 149th Street, take a left, go to 104th, and go a half a mile south, and you're there.
Yeah. So I think it might be helpful too if you just explain, and again for public, the concept behind Haven Hills, and kind of where they're going to grow that, where that came out of.
It's the idea. It came from a concept that's actually a program in Oklahoma, to where they have a foster care community, and it's homes that would have families that support foster kids in need, and they would also have in-house therapies if it all works out. So, and shared services if need be, so we're not all competing for the same things that we're all desperately looking for. And just like you mentioned before with your programs, some of the things with fostering is keep them in the home, so in-home placement's not a necessary thing. You're actually fostering some of those needs to where if we can build up families, that's a win for everybody. Mm-hmm. And it's just another complementary service to add to it. But if it comes to full build out, it would be 12 homes that could support up to 40 kids with all of the therapies, and then all of the different stakeholders, like you mentioned with the schools, some of the different changes and their public-private partnership with all these mental health providers have made it really hard for all of the other services to gain personnel, but the school system says that they're fully staffed in those areas. Well, that's where some of those shared services, if they can be had, would be a thing. So it's to really define it, what you're asking is hard because there's so many what ifs that go with it. But we're certainly willing to build those relationships, learn as we go, and let's just make this a really fruitful thing for Burleigh County as we go forward. Because the zone board, with all of the changes, as I've talked with Becky about before, we really deserve it. We need to be a flagship area for this state. And I think we can do it because I think we're second to none in Bismarck.
I second all that. No, and I do know from talking to Amber, like you said, you just don't know where it's going to go. There's some different things that could come out from what you're able to accomplish and the build out. And I definitely support those other practices, having a place to come together and serve community in a kind of one-stop shop when we are seeing the schools doing more of the contracting with certain entities. And some of our kids just do better with some of the other entities. So this is great.
Yep.
From anything I have to add. Any questions for Mike?
Thanks for your time.
Thanks, Mike.
Thank you, Mike.
Any other comment? Okay. Any other business that anybody on the board wants to bring up? The only other thing,
Yes, I have two items just for updates for the board. On the budget, there was two amendments added. They took out the equity study of $1 million, and they also added language stating that one legislator must be on our board. Before it was up to us, but there's an amendment going through now that will require that, and it was attached to 2012.
two things. Tayon, could you help me think about, I thought that was already established for zone board formation, that you had to have a elected public official. So are we just, that's not true, Becky's saying no?
No, no.
Okay.
It was not, you need to have representation from your county commissions on there because we're only one county. That means only me, but no other elected official was designated in Century Code that needed to be on the board.
Okay, so we were just very lucky
So
to have Senator Dever. Okay.
So I just want you guys to know I've been advocating for that equity. The House pulled it out, but we'll see what happens in conference.
Thank you, Trevor. Yeah, I mean, all the employees and the public should know that Trevor's always advocating for our needs up at session, but he's definitely been all over the comp equity study. So
Yeah.
that was the one thing I had too, was to visit about comp equity.
So it did pass the House, Trevor, but it failed. It passed the Senate and failed in the House.
Yeah, they pulled it out. The Senate put in $1 million for just a placeholder, but the House deleted it. So we'll see what happens.
Okay, thank you, Trevor.
So when
I'll
we,
keep watching.
thank you, Trevor. Yeah, when we had started, the proposal was, and I think I had some of these numbers right, but it was 17.1 million was what was the ask was for zones to come, like basically address some of the discrepancies across the state for equity and compensation. When that was in the Senate side, that wasn't supported. They felt like with the study, there was a comp equity study happening that wasn't completed, so they didn't feel like they had supporting information to support that 17.5 mil. Our budget is very heavy in HHS, so they just, I mean, because we're covering all the aspects, the aging services, the child care, the state hospital, right? So it just, DD services, they, like Trevor's correct, that committee pulled the 17.5 mil and just gave us a mil as a placeholder to get it moved to the other side. So then the budget moved to the House, and so Trevor's correct that last week they pulled that mill and said that we didn't need the comp equity in general, like, kind of period. Comp equity goes further back to when they did the formation of the zones. This is what I'm learning, is that was always kind of promised, whether that's right or not, that we were going to do the formation of the zones and the redesign was going to happen and comp equity was going to be studied and addressed to address the inequities and the disparities. And so there's half of them who think this is the right thing to do and we should move forward with comp equity, which obviously Trevor and myself, and I hope you would support as the board. But then you have others who say no. So that's just kind of, he's correct. We're hoping that it goes to conference committee and we can get that money restored, at least that 1 million. Like we said, we were asking for 17.5.
And I think some of the legislators do realize when they did this change to the zone concept. I know there was also a motion made, but it failed in House of Ropes that was going to say transition it all to state employees. All state employees become, the county ones become all state employees, but it failed 3 to 5.
Yeah.
So
That was kind of like a last minute
Yeah,
amendment, and again, that's a bigger conversation about zone employees being that hybrid. We're half state, but we're county.
yeah.
So there is no movement on that. We are staying as it is for right now. But the biggest thing is just advocating for that comp equity. And it would, the governor, I believe, was at, when budget started, was at that 4 to 6 for that raise. And so now we're kind of back to nothing. And we do not get when, a county employee gets a 7% raise, my zone employees do not get that raise. So that's kind of where we end up in that hybrid. So that's probably worse.
You don't even want to see what's happening because it's very, for me as, as a county commissioner who's partially the decision maker as far as benefits and, what days you can have off and those things, like what the work calendar looks like, what contracted hours look like, but then the pay is not under that. It's really hard to help recruitment retention in my own community of zone employees. And, but they really need to look at equity right now for all zone employees because we are not the only ones struggling with retention and recruitment. It is not just in North Dakota, but throughout the country, a huge need. It's a huge burnout area, and we need to look at what we're paying our workers to do that job in the community. But it's frustrating for me that I can only do one very small piece of that triangle to help support our staff.
No, I mean, I agree. I just having the conversations with whoever's willing to kind of hear you out on it. Only because then we're talking about the idea of the state versus, I've had conversations with my staff on, what are the benefits of being state? What are the benefits of staying county hybrid like we are? Think a lot of it comes down to the pay and, the benefits. That's part of it. But one thing that I look at is when we talk about inequity of the workload. So I've been really having to battle against, other zones and those directors pointing out those discrepancies on, okay, so your 5-mile drive from me and your workers carry 5 or 6 cases and I'm carrying 23. How is this fair, even? Where right now that's kind of up to that zone to decide, right? So I don't really know what other steps to take than going to that director and trying to have a conversation on these are all North Dakota kids. These are all North Dakota workforce. We need to be working together. And I am seeing them, collaborate with me more and more every week that we have those conversations, but I would be lying if I didn't say it was like an uncomfortable rub to have to, push back against the way people have been doing it. But if we were state employees, I do feel like that equity of that caseload would be easily resolved, right? Because we're all then one. Like right now, we don't have that oversight over all the zones, so.
Good.
Director Flory, how come is it that we're a hybrid? Is that something the workers wanted or what?
No. That was, so when the state took over the zones, which was, Tiana, you're going to have to remind me what year that was. Was it 2018 that bill first passed or 2020?
I think there was some preliminary stuff done, but most of it went into effect 2020 and 2021.
Yep.
So what happened is all the direct costs for our human service zones, what used to be county social services went to human service zones. So pretty much every other than us, Ward, Cass, and Grand Forks took multiple counties and made one zone. And shared staff, because sometimes let's say Mercer County didn't see enough medically fragile children to have a staff that was well versed in that. But if you put 4 counties together, they could have one staff that was well versed. So it was a good way to streamline some of that. But also it took it off the county's property taxes and went to the state. So they pay those direct costs. Now we have some indirect costs still that we are responsible for as a county. So really, this was not up to employees. Even when I first started on this board, the employees were very confused of who their bosses were and
Right.
who employed them. So they are under the state merit system, but county employees. But they have their own policy and procedures manual. So I really just consider them zone employees. I don't mean to be disrespectful saying I don't consider them county employees. I want them to feel like I'm their portfolio holder, I'm their county commissioner, but they don't have the same roles as some of my other county employees do. They are zone employees, and thus there's certain things in our policies and procedures manual that are followed differently than I follow for my other county employees.
A ton.
Right,
Yeah, a ton,
because otherwise they'd get no benefits.
Yep. When we go to like department head meetings, there's probably 90% of it isn't applicable to
Right.
me because they have different, I have to follow a zone HR policy manual that may be different than the county. So it is very confusing. But for you, Galen, I know the board has gotten this historically, but I can float back out the formation of zones, how that came to be from 2020, the bill that came into effect. Then there's a nice chart that shows you this is county, this is state. It kind of breaks it out for you because my staff needs to know your pay and benefits are county, but yet your policy and procedures coming out of the state. This is why it gets very confusing when we're trying to even do progressive discipline with a staff, right? They could be very different for what is the zone policy manual and then what is my host counties. Yeah. And it gets more confusing, like Commissioner Matthews was saying, when you have multiple counties within a zone, they have a host county. So those ones had to come together and decide, okay, is Kidder County going to be our host county or is Emmons County going to be our host county? So we are lucky that we are just Burleigh County at this moment.
The other thing is that's why we are an advising board and not a decision-making board.
Yeah.
We can advise. The only thing we really help advise on is the hiring and annual review for the director position. Otherwise, we just provide the community support such as Mike brought up today, or, you know, if you've had great relationships with Tracy and Tracy from the school district gives feedback on. So really, we are that advisory board to see what's going on in the community and bring it back. You bring to us on the board that's involved in the community, say, hey, you know, what are you hearing about the call center from people you work with, or what are you hearing from, you know, the sheriff's department working with CPS? It just gives, because we're just an advisory board.
Yep. Any other questions about, I mean, it's very complicated, so we probably shouldn't.
It makes the mud very muddy.
Yeah.
Yeah,
Yeah.
it's taken me 2 years to find, and then I finally think I figure it out, and a new little thing gets thrown in, and then I've totally lost it.
Yeah. Yeah, it's complicated, so. But I can get you the information on that, and then that way you can at least have that timeline of how we formed, what that looks like. And like Trevor said, they tried to slide an amendment just saying that we would just become state employees. So that could be the writing on the wall like years from now. I mean, it definitely isn't probably going to come out of this session, but down the road. Which then brings Commissioner Matthews' points about commissioners wanting to know what's the state doing to secure our rent, will we sign a lease? Because on their end, if they're going to try to sell our Provident building and it's more marketable to say you have somebody who's in there with a 5-year lease, but then all of a sudden if we become state employees, is the state going to decide to pull me and put, you know what I mean? So there's just a lot of partners that I try to keep straight in my head and work with. Okay, well, I don't have any other business. That was really it. Thank you, Trevor, for talking about comp equity. That was the only other thing I had to talk about as far as what's coming out of session. And hopefully that wraps up, so. Okay, meeting adjourned.